The patient is to have liposuction of the upper back and a revision procedure to the waist. He's positioned in the prone position. The blue areas represent the areas to be treated. The skin has been covered with a disinfectant that smears the ink a bit. The patient was given a mild sedative to minimize anxiety and discomfort. 4 access points have been chosen, and the skin is infiltrated with a small amount of local anesthesia. Local anesthesia is acidic, so a small amount of bicarbonate is added to neutralize the acid, which makes the injection into the skin much less painful. We also play soothing music, which the patient prefers, that we know increases amount of discomfort that patients can tolerate during this awake procedure. Small holes are poked through the skin to gain access to the subcutaneous fat. These are very diminutive and so small that they require no suture at the end of the procedure. The knife is inserted through the anesthetized skin, so this part of the procedure is painless. The mouth of the opening is made bigger by inserting and spreading scissor tips. This makes access a bit larger without increasing the length of the incision. As the liposuction cannula will pass back and forth many times through the holes in the skin, we want to minimize any abrasion to the skin that might be caused by the passing cannula. This is also aided by placement of a lubricant at the opening of the skin. The next step is to introduce the tumescent numbing solution. This is a saline fluid with lidocaine added to numb the area to be treated. We also add a small amount of epinephrine, which prolongs the action of the lidocaine and causes small blood vessels in the fat to go into spasm, thus decreasing bruising and blood loss. In properly executed liposuction, blood loss is negligible. We use a very narrow cannula and infuse the numbing solution slowly. This makes the process very tolerable. Furthermore, it takes about 15 to 20 minutes for the tumescent ingredients to achieve their full potential, so there is no reason to rush. I've started suctioning on the patient's waist. This is a revision procedure. It's unlikely much improvement will be had, but the patient wants me to give it a try anyway. It will be slightly harder to perform than a virgin procedure because of scarring. I don't charge a professional fee for a revision, so the patient really doesn't have much to lose. There is very little risk to a revisional procedure. The patient incidentally has had cool sculpting to the waist several years ago. This was of no benefit and does contribute somewhat to the difficulty of a revisional procedure. Cool sculpting doesn't work very well, perhaps removing 20 to 30% of excess fat. So in my opinion, cool sculpting is money not well spent for fat removal. Suction of the upper back is now undertaken. As the procedure is performed directly over the rib cage, it can be a bit more sensitive when the vibrations of the liposuction equipment can be picked up by the ribs. Some patients perceive this as tickling, and I've had patients laugh during the entire treatment. The success of liposuction anywhere on the body is determined in large part by the way the skin adapts to the reduction in volume that's embraced by the skin. This patient has excellent skin and only a modest amount of surplus fat. so he should expect an excellent result. The final determinant in liposuction, which has a number of nuances, is exactly when the liposuction is complete. That is, when should the surgeon stop? The endpoint is when no further fat is coming through the liposuction tubing. There's really no judgment as to how much fat should be taken or how much fat should be left behind. We simply end the procedure when it is no longer productive in delivering fat from the area that's being treated. We do ask that the patient wear a compressive garment, primarily for comfort. After liposuction, because so much tumescent is used, for about 24 hours the fluid will back out. For this reason, we put an absorbent towel around the patient's waist so that the fluid will not leak onto anything that's important when the patient returns home. The patient will see immediate benefit, but the final benefit takes about 6 to 8 weeks to be achieved. Patients are allowed to return to full activity the day after the procedure, provided it doesn't hurt. I myself had liposuction of my waist, and I played golf the next day. The patient will return to the office in a few weeks for follow-up. There are very, very few complications with liposuction.